Whether you're in a small town or a city in Canada, you know we have a drug problem. You see people stoned out all the time. We don't know the extent of it though, but Adam Zivo does. He is a journalist with the National Post, and he joins me right now. You've produced a number of columns which are quoted in the House. They're stunning. Tell me how bad it is in Canada.
The situation is awful. So we have this thing called Safer Supply, which claims to reduce overdoses and deaths by providing pharmaceutical opioids as powerful as heroin as an alternative to potentially tainted illicit substances.
Right.
But a significant portion of those opioids are actually being sold on the street to fund the purchase of fentanyl.
I mean, the opioids that people are being given,
yeah.
They're saying they're walking out. I've heard this, and I've read it in columns. They're walking out and selling it on the street, and they take the money, and they've got money, a lot more money for a lot more bad drugs.
Exactly, because the thing is that though hydromorphone is as powerful as heroin, it's only 1/10 as strong as fentanyl, so it doesn't get fentanyl users high, so they don't want it, so they sell it.
Adam, is the situation getting worse than it was, say, 10 years ago?
The opioid crisis is obviously getting worse, and the problem is that our policies are not mitigating that.
You say
it's
obviously
exacerbating.
it's getting worse. So somebody walking along the street, even in a small town, and people are cooking up drugs to stick in a syringe into their arms. They've never seen that before. You see it on every street corner now in Toronto. But that's anecdotal. I mean, do we know that it is getting worse, in fact?
Well, when we look at our overdose deaths, they're climbing higher and higher, so that hard data shows that trend.
Okay, and so when the government says our policies, these programs are working, you say to that, baloney.
It's baloney because the evidence base that supports that claim is very, very weak, and that's something that could be discussed in a lot of detail another time.
Yeah. So, okay, so let's just talk about then what the government is saying. Carolyn Bennett, the Minister for Mental Health and Addiction, stood up in the House the other day. She literally blew a gasket when someone challenged the policy of giving out drugs. She said, "We are saving lives." Mm-hmm. True or false?
False. I'm a little bit concerned about Carolyn Bennett's competency, to be honest. She cited a study which was incredibly weak. It was a small qualitative study, meaning that it was a series of semi-structured interviews with a small group of Vancouver-based drug users who obviously are not going to give the most objective assessment of the situation, and you don't base addiction policy off evidence like that.
Well, why is she?
There's a strong sense of ideology guiding addiction policy making at the federal level. That leveraging of low quality evidence is very common in that space.
Adam Zivo, thank you very, very much. Talking about ideology and ministers, I think our Prime Minister does some of that too. Thanks very much. 3 minutes. This country needs bold and fearless discussion of the issues that are confronting it. And the Trudeau government is censoring the news and paying other news providers. So we need to keep going. Please subscribe. And please donate generously. The crew needs to be paid.